Welcome everyone to this off-week community call. This is a special, a special convening related to the vaccines and reopening. I'm glad that so many folks could make it. Kind of short notice, I think, too. So our facilitator today is Oren from Commonweal, but I'm still not sure that we have everyone. So I'd like to wait one more minute. If folks could put either in your title for your little box or in the chat what organization you're from too, I think that might help us all understand who all is in the room. Got 3 or 4 more coming in here.
Hello.
Hello, welcome, Sister Jane Marie.
How are you?
Doing very well. Good to see you.
Good to see you also.
Oh, good. A couple more here from our steering committee. Rashmi, welcome from Mount Madonna.
Thanks. I'm in a situation I have to mask.
It's rare on Zoom, but I appreciate you being safe.
But I have to share a building. Our electricity's out and our internet's out, and it's just, we're having a massive windstorm. So we're kind of all huddled, sharing a room. So
yes,
to find the internet.
I'm glad you made this a priority in the midst of everything you're going through.
I absolutely wanted to come. It was very important. So thank you.
Of course. Oh, good. There's some more comments here in the chat. Welcome from the Darst Center and from Kripalu. Justine, did you have other announcements that we wanted to start this session with, or should I pass it over to Oren?
Just pass it on.
Okay, Oren, if you want to go ahead and get started, I think we have a quorum here.
Great, thank you.
Oren,
welcome.
Can I just introduce Rob Whitmore, who's one of our board members who's here? So I just want to welcome him to our group. Thank you. Thank you, Oren.
Thank you, Jean. Thank you, everybody, for being here. I have to admit that this community call is a little self-serving. I told Ben we need to do a community call about this because I have all these questions to which I do not have answers. And I said there must be other people out there. And then I was like, well, you know what? This is one of the reasons RCC was created, is to create the community where you can ask these questions. So our goal today is to start the conversation about, we've had the conversation about how pandemic has affected retreat centers, has COVID has changed our work, has changed our calling, has changed how we conduct business in the world, both on the personal, spiritual level and also on the organizational level. But now as we're looking ahead, changes are upon us in many ways and many, yeah, it's kind of like the day before the inauguration, changes upon us. And, but more specifically within the context of COVID and retreat centers, the vaccine is changing how we interact with each other. So we just went through this major transformation about like, you can't touch other people, can't be in the same space, to an unknown future about how things will unfold. And I'm recognizing that there's a lot of unknowns. So what we're hopefully doing today is to start the conversation early enough. Right now, we're in a surge, at least in California, we're in some kind of lockdown. So this is not happening imminently, but usually we plan our retreat centers at least 6 months out. And in 6 months out, who knows, maybe there will be retreats, maybe things will change. So that is kind of the goal for today. And how many people do we have, Ben? I was hoping that maybe what we could do is a quick go around in what we use the term of Zen brevity. And first start here, let me give you an example. Oren from Commonweal in Bolinas, our retreat center is closed. And at the moment, we're taking registrations from July on, for example. So that length, really short. I'll call on you based on the order, which is in the participants list, which is roughly alphabetical. So just introduce who you are, the retreat center, where you are. What is the state of your programming right now? Like open, close, we're doing individual retreats. We're fully holding community retreats. Hoping we can do that in about 15 minutes. After that, we'll talk a little bit about what are our assumptions about moving ahead, because designing how we're going to create policies or how reopening happens depends about what it is that we assume will happen. So we'll have some conversations about knowing that nobody really knows the answer. And after that, we'll actually, depending on kind of how we feel about it, we'll either have a group conversation about potential policies, or more likely we'll break up into groups of 4 and kind of share our thoughts and then reflect with each other, collecting this at the same time on a Google Doc that we'll share, which that we will be able to start collecting those ideas and see how that will serve us into the future. So with that in mind, I'm going to start going around. Remember, really short, and in some intervals, I'll just do a reminder, because there's this phenomena that happens in circles, and I'm sure you've never run into, which is when you're like around the 5th person, that Zen brevity becomes larger and larger and larger and larger. I hope it's to stay focused. We don't want to use the whole time, but I really want to know what is the state of the sector right now? And that can all come through on your, it could come in the room. So why don't we start with that? And we'll start with Ben.
Hello, my name is Ben Scott Brandt. I work in Grand Rapids, Michigan. I'm the coordinator for the Retreat Center collaboration. My work is fully remote, so it continues as usual.
Jane Marie.
I'm Jane Marie Kudlatz. I'm at Villa Maria Education Spirituality Center in Villa Maria, PA, which is right on the Ohio-PA border. Right now, our center is welcoming individual, and we have people coming for personal retreats, one-on-one. We will probably have some small groups starting in February. Again, we stopped in November just because of safety. And then we're hoping for our programs to begin possibly in August.
Thank you. Dharmakaya Center.
Hi, I'm Trevania Henderson. I'm president of the board of the Dharmakaya Center. We also closed in November and are planning to reopen the first weekend in March with retreats that are limited to 10 people. Our meditation hall holds 100, so we feel like that's safe. And then our hope is that by September, we'll be able to be running full bore.
Thank you. Rashmi Cole.
Hello, everyone. I'm sorry. We're having a little crisis here and we're all in the same room for internet. So I'm asking, I'm from Mount Madonna Center in Santa Cruz, California, and we are currently closed. And I'm part of the group that is looking into what our possibilities are.
Thank you. Andrea from Hollyhock.
Hi, good morning, everyone. Andrea. I am the campus director at Hollyhock, west coast of Canada, and we are seasonal in-person operations. So we usually don't start our season until April. So it's common for me to be closed right now, and we are planning to open our in-program calendar in person in April.
Thank you. Connie.
Hello, Connie Palm, Shalom Spirituality Center in Dubuque, Iowa. And we are open for spiritual direction appointments, small groups that are just maybe an hour or less in their activities. And by small, I mean 10 or less, and private retreats.
Thank you. Arlene. Peterson? Arlene's staring at me. Arlene, when you get, oh, there you go.
Sorry, oh my God. Hi, I'm Arlene Peterson. I'm with the Poor Handmaids of Jesus Christ. I'm actually going to defer over to Paul to talk a little bit more about Lindenwood Retreat and Conference Center here with the Poor Handmaids and give you an idea of kind of where we are. But we also have a retreat center called Moon Tree Studios that currently isn't having any programming until possibly May of this year.
Thank you, Arlene. Peter, you want to go? Paul, do you want to go next?
Sure. Paul Mock, Lindenwood Retreat Conference Center. We are half hour south of South Bend, Indiana. We have been open since June. I've had hosted groups here. We've had sponsored retreats and private retreats. Mostly we've been staying within the guidelines, whether it's below 50 or right now below 25. Mandate masks and social distancing in all our situations. We also have full bathrooms in every bedroom, which helps also. And actually told a group yesterday, don't come. They were arguing about wearing masks. I said, we don't need you here, so don't come. And you gotta be stern on that. And we have not had any cases here at the retreat center with even hosting since June. Not a single group has called and said we got COVID because we came.
Great, thank you. Deborah from Gilchrist.
Hi, sorry, I'm not quite settled yet, but I'll turn my video on soon. I'm from Gilchrist Retreat Center in Three Rivers, Michigan. We've been open for individual guests since July, and we're trying to discern how to be able to host guests at some point this year, summer, fall, but we're still working that out.
Great, thank you. Let's see, the team from Kripalu, we have Heather and Robert.
I'll go for us, Robert. I am Heather Brockhern. I'm the Senior Financial Analyst at Kripalu Center. We are currently online. Our center is closed, and we currently do not know when we are going to open the center.
Thank you.
My name's Robert, and everything Heather said.
Thank you. The Whitby Institute, Heather and Marta, and anybody else from Whitby.
Yeah, I'm glad to be here with Marta. Marta's been holding our COVID health role, and I'm co-director. And we had a really wonderful small group series, and then in Washington State, hard closure. And we're looking at staying closed through April and holding restoration and renewal retreats for vaccinated folks in April, latter part of April, and groups wanting to return in May. Marta, I'm throwing over to you.
Nope, nothing to add. Thank you, Heather.
Great. We're moving on to Kirkridge, and we have Jean, Rob, and Justine.
Well, I'll start and then pass it over to Justine and Rob. I'm Jean Richardson, and at Kirkridge, we've been online, doing a lot of online programming. We've been open for private retreats and families that want to be together, and maybe we've had a couple small groups, but mostly we're closed, and we are closed until we can figure out how to reopen. Justine, you can add to that.
Yeah. Hi, everyone. I'm the Associate Director here and then also support the Retreat Center collaboration. Yes, and I would say we also do our own programming, and that's not even on the calendar yet. So we're just doing rentals through the year. Rob?
I'm Rob Whitmoyer, first-time visitor here from Harrisburg, Pennsylvania, and I serve on the Kirkridge board.
Great, thank you. Joanne from Knobs Haven.
Hi. So we have two retreat services here. One is very small, a couple of areas that are very small where we serve up to 27 people. The other is a cluster of 7 cabins for individuals. The cabins have been open since August and have been doing very well. The group areas have been closed since March. We happen to be on the grounds of a mother house of a bunch of women, sisters whose median age is 86. And so we've had to take some extra precautions. We only do hosted groups, no programming.
Thank you. Kevin from Dreiger Hermitage Community. Kevin Dreiger from the Hermitage Community, and I saw someone else here from Hermitage.
Yeah, Kevin Driedger, whatever you want. From the Hermitage, we've been open on a limited scale since June of last year. Currently, we are, for us, I would say we do primarily individual retreats, and we're at limited capacity because part of our typical service is providing meals for guests, and we are not able to provide meals for guests at this time. So guests are on their own for meals. So we are, I would say at about a third of a typical capacity, with almost no group reservations. Groups being, maybe 4 people that will come together, but still take care of themselves.
Thank you, Kevin. Naomi?
Yeah, Naomi from Three Rivers from the Hermitage, and we're doing online programming, meaning online spiritual direction and a few online retreats, in addition to these individual retreats that retreatants have come.
Thank you. Oh, Ling, I missed you before when we checked in with Hollyhock.
Hi, Oren. I'm Ling from Hollyhock. I'm the program director here. I'll just add to what Andrea said. We are optimistic about opening in the spring, but we will make a call mid-February about our in-person programming. We're probably going to treat programs led by local regional presenters differently than those led by international for obvious reasons. And we also have a 10-month virtual program calendar we're running through right now.
Thank you. Natalie from Villa Maria.
Hi, everyone. I'm Natalie, the assistant director at Villa Maria in Northwest Pennsylvania, along with Jane Marie. So just to add to what she already mentioned, we're in a phased reopening. We have a really similar dynamic to what Joanne said about having a community of sisters and a nursing facility on kind of the campus with shared space, shared food facilities, and some shared meeting rooms. So we're really limited in our space right now. And so we're in the phased reopening and having some virtual programs.
Thank you, Natalie. Rachel Lyons from the Dar Center in Chicago.
Hi all. Yes, Rachel here. I'm the program director at the Brother David Dar Center. We run social justice education programming for high school and college students. So we've been doing all virtual since schools have policies around not traveling right now or doing in-person things. So we're kind of waiting for both like Chicago, Illinois restrictions to move forward for overnight centers, but also whenever schools feel able that their policies can be changed to travel and parents would send their kids to travel.
Thank you. Greg, Watershed.
Is a little late. Hi, I apologize. My mom is late for childcare, so I'm a little preoccupied. But Greg, from the co-director from the Watershed Center in Millerton, New York. We've been closed since March. We have been using the facility for short-term rentals with a neighboring facility, which is a Zen monastery. And we are targeting some kind of phased reopening around June. Thank you.
Great, thank you. And last, Sue from Dominican Retreat and Conference Center.
Hi, I'm Sue from Dominican Retreat and Conference Center in Niskayuna, New York. We closed in March. In June, we opened up our Windmill Hermitage for private retreats. In July, we opened up the retreat house for small groups up to 13 and are doing virtual and hybrid. So people in-house and virtually with the smaller numbers. In December, when the infection rate was reaching 4, we went all virtual. We dropped in the last week from 10 down to 7. So we're watching, we're holding all virtual. As soon as we hit the 4 again, we will once again allow folks in-house. We're allowing them to sign up and week by week saying, sorry, but we're still going to stay virtual for that program. So it's a week by week approach.
Thank you. I think that was everybody. If someone comes in late, Ben, if you could just ask them by chat to have them check in on the chat so we can keep this flowing. The next question is, what are our questions and what are our assumptions about moving ahead? If you go to the Google Doc that Ben shared in the chat. We can start posting some of our questions there as we go on, just so we have a collection. The reason we're doing this in a Google Doc is that I have a feeling this conversation is going to be going on for a while. So we want to have a place that can stay open and that we could keep holding. I can share. So what I just wanted to have is a few of us share kind of what are our assumptions as we move ahead. We have certain things that we know. We know that there's 2 vaccines that are out. There's a few more that are coming. We know that each state has developed its own policies about distribution and that each state is progressing at a different speed. Right now, where I am in Northern California, we're still vaccinating people over 80 and emergency and medical professionals. I know in other states it has been changed, but we're assuming that at some point the community will be somewhat vaccinated. The timeline is something we don't know, but as I said, part of our dilemma is how do we define what the timeline is? Should I be booking now for July or September, right? And if these are some of the questions that I have, and after I'd like other people to pop in or put them in the question, it's like, my question is, when do I start booking and what kind of booking? So I feel like in July, maybe we start booking with our summer camp programming, which is mostly people under the age of 30. And the work that we do with people with cancer might have to wait till a lot later. So that's, for an example, a question that I have. What are other questions? And if you just want to maybe either just pop in or raise your hand, but it'd be easier if you just said something. Go ahead, Heather.
A key question I have has to do with vaccinations, requiring them, not requiring them. Requiring them provides safety and presents an incredible equity barrier. Also recognizing that much of our team is actually in low priority. And so, and then the other question of requiring team to get vaccinations or not.
I just want to say yes. That's my question too. Thank you, Heather.
There's a few screens, so if you want to say something, just unmute and talk.
One thing we're trying to think about at Kapalua is we did a walking tour of another, not a center, but like more like a resort in the area. We did that back in, maybe it was September time. It was just so obvious how much additional cost that they had spent on managing COVID protocols, just even on signage alone. It was like, they said they sort of had to create a whole new team just for signage. And we would, in an ideal world, I think we would love to avoid, try to time things where we could avoid having to incur some of those costs that may not last for a long time. So, yeah, I'm just wondering how people are thinking about the COVID-related protocols, and let's say even if there is good rollout of the vaccine and good uptake of the vaccine rollout, and at the same time we start to see the health indicators dropping, which is going to be the real indicator of safety. Are people expecting COVID-related additional costs, and what are they looking? How are they even quantifying that or making estimates in their 2021 budgets for that? I just throw out the easy questions that everybody has a real quick answer to.
The answer is yes.
Yeah, and no.
Shall I add another question? This is Brooke.
Please.
Questions around liability. You know, in my mind, getting I assume, and I know this won't be easy. Thank you, Heather, for your question around even just our whole staff getting vaccinated. But I'm very much assuming that many of our guests will choose not to get vaccinated, particularly around experiences around colonization and histories that will make people reticent. And so I am imagining that Watershed will not require our guests to be vaccinated. and will have some sort of a legal waiver. I imagine none of us know the answer around that, but I imagine there's some legal precedent elsewhere around liability. But I can imagine that while we would keep our staff safe, that there could be a super spreader event at Watershed if there are people that are not vaccinated. And I'm wondering if there are thoughts around that, either around liability or around responsibility for people choosing to come to such a thing, knowing that they're risking that for themselves. I'm sort of like, that's how I'm rationalizing it, but I don't know if I feel okay about that.
The question of both moral and legal liability around guests and staff being vaccinated.
Yeah, just to kind of, I really loved that question and the context you provided around it. And I think kind of related, some of my questions are around communication with guests. I heard somebody mention in the introduction, like a group, Paul, a group, not wanting to wear masks or having even a dialogue about if they're going to do that when they're here. And we've had that happen. Yeah, and so curious about like best practices and, compassionate ways to communicate, but have boundaries around, what protocols look like, and then how protocols unfold, between now and whenever, and how to stay most kind of on top of that. Because that even in itself seems like a lot of logistics to kind of stay on top of just what best practices are with masks, cleaning, other things.
Thank you.
I'm curious, all the centers aren't the same. We all have these different physical plants that we deal with, which are benefits and sometimes liabilities. One of the things at Kirkridge is we share bathrooms. So that's one issue. We usually have double rooms. That's another issue. And we do sort of a food line. So all of those things are just wrought with challenges as we open. So I'm interested in what other people are thinking about shared bathrooms and double rooms, because that changes your occupancy levels. And then also any solutions around food.
Thank you, Jean. Shared bathroom, shared room, food service. Paul, are we going to ask a question?
I can speak a little bit to that, having to deal with it in the past. I mean, you're not having bathrooms in each room is probably your biggest obstacle. And yes, we even had to go down to one per room unless they are from the same family, and that, which is very rare. And then food lines, we started by having food brought over. But once we got over some 20, even, brought box lunches over, that kind of stuff, it got to be chaotic that we ended up having to work it, that we set up times for each group. So no one else other than the few people working the lines really had any connection to them. In even the mother house where our food service is, they usually did not connect because we had their eating room separate and they went through a line. So yeah, those are all the interesting challenges that you do have when you're open is how do you make all that work?
Thank you, Paul. And so, I mean, our hope is to create this space where we can learn from each other. Are there other questions? If you do have answers or ideas or suggestions, put them in the Google Doc so we don't lose them. This is not the time let's keep it at the question level. We'll be moving to answers, but if there's things trigger an idea, please put it in the Google Doc. Other questions or concerns? Ling.
Thanks, Oren. Just on the topic of spaces, I'm curious how people are thinking about session spaces. Pre-COVID capacity, our session space might be 60 people, and now with distancing, it's about 20. So I'm curious if people are, weather permitting, thinking about outdoor spaces or like just creative ways you're all thinking about gathering larger group numbers under the restrictions of 50, of course.
So questions of capacity and spaces. How do you manage indoor and outdoor spaces? Other questions? We'll take maybe one or two more. Okay, a question that I was having was, what is our legal, what can we legally do? Can we mandate our staff to get vaccines? And that's the question from a moral perspective. Of course, there's the medical perspective as well, though that's a lot easier to answer if someone can't take it for medical reasons. So we have both the moral question, but then there's also the legal question. I don't know if you can actually, hospitals can make people take vaccines. I don't know if retreat centers can do that. And then how do you deal with the question of, can your food service people or your reception people not be vaccinated? So I was wondering about that as well.
I think there are state to state laws around that. And I need to look into this more fully, but I felt like I heard that in New York State, you can mandate that food service and hospitality workers have the vaccine.
Mm-hmm. Thank you, Brooke.
I have a question just about pre-travel communications and how to have our guests be really excited about coming for an experience while also filling out a health declaration and being in touch about really risky things around COVID. And I think what also falls in there is cancellation standards. I'd be really interested to see what other centers are doing as far as holding the liability if something were to happen to an upcoming guest around COVID. Who's gonna hold those funds? Those are my questions.
And I have a question. Mount Madonna Center has a resident community as well as a children's school. And while we have a lot of space, it's been a little challenging to, so there's a lot of fear navigating and balancing the residential and all the different activities. So everybody feels okay, which no one does, but.
Right. Thank you. So how does it affect the people that are living? We heard some from retreat centers that are in communities, from women or religious communities. How does it affect sisters as well? Yes, somebody raised their hand. If you have a question, just unmute. Going once. So go ahead.
Well, I have a question. And it's just really, as we look at what will probably be another transition period. So, people are getting the vaccine. There is some buildup of a little more safety. What kind of communication and I don't want to use the word publicity, but how do we make it safe? So communicate that we still all have to be very careful, because that's kind of what we're being told, that even though there is a vaccine, we're still going to have to be careful. So how do we require people to that level of carefulness when it may not be the level of carefulness that is in the general public? And I see that as going to be a growing concern, because people are going to say, we don't need to do this anymore. We're not required to do this anymore. But when we bring together people into our centers, can we put on those requirements for safety purposes?
Mm-hmm. So what kind of requirements can we put on? And what is the publicity around that? So I want to move us to kind of a smaller section that there are a few assumptions that we're making about the world ahead that have come out of this conversation. And I'd like your help to maybe we can capture some of them. For example, nobody talked about quarantine, right? So it seems like nobody's going to be doing quarantining before people come out. Back in the day, like 6 months ago, we said you come out for 2 weeks of quarantine and you can come in and retreat. That was one thing that came up. Another assumption that I'm hearing is that things are not going to be back what they were last year. That we're clear that there's no going back to how it was before February 29th, last 2020. So that's another assumption. So things will be changing. The third assumption that I'm hearing is that vaccination is not going to be uniform. That we're assuming that both within our staff and within our guests, potentially within our teachers as well, there's going to be different levels of vaccination. And we're looking for pathways of how do we adapt to different levels of vaccinations, right? There's the dream of everybody's vaccinated. We're done and we can move on. We're all one of our assumptions is that is not going to happen. So I wanted to put that out there. Are there any other assumptions that people are hearing from our conversations?
Necessary practices, maintaining, responsibility, awareness around liability, both. I really appreciated that ethically and then logistically.
So that we're going to have specific practices that we're going to have to adopt that have to take into account our legal responsibilities. As Robert from Kripalu mentioned, the financial cost of doing those things. And we're, you said ethically, legally, and practically. Those the three ones? What other assumptions have gone in?
I think another assumption we're making is that if somebody has the vaccine, they would not be able to get the virus or carry it. And I don't think we know that completely yet.
So we're making some assumptions about the science that we just don't know the answers yet. And we've heard the conversation, at least I've heard, but that could be because I live with a doctor. If you have the vaccine, you can still be a carrier. Your likelihood to be infected is 95% reduced, but we don't know the long-term impact. We also don't know, just to add about, there are questions around the science. We don't know how long you are going to be vaccinated for. Mm-hmm. So there's that layer as well. Other assumptions that we've been hearing in the conversations, both the first introduction of what we're doing and our questions.
Well, and given all of that, Oren, brace ourselves for long-term practices. So.
What do you mean when you say long-term practices?
So I know we have shifted, most of our rooms are shared. We have shifted to, for 2021, single rooms. Long-term financial viability, single rooms won't cut it. So I think, some either reckoning with we're booking for 2022 because people are super excited and hopeful. And yet what scale of groups are we booking for 2022? What scale of compensated staff team do we design for to keep this thing afloat?
So there's some long-term structural changes that we have to start planning for, both financially and structurally, literally in how we hold our spaces physically. Other assumptions?
I'll just, I think, at least for me, is that that the guests will come, the guests we have at the Hermitage are coming with different needs than they did before COVID, and that are bringing something different than they did before COVID. And I think that what our guests bring will be impacted for sort of how they are. I mean, what they're dealing with and what they bring will be different for quite some time.
So part of the assumption is that the stance, the perspective, the attitude, the behaviors that our guests will be bringing, we're thinking will be different now than they were before.
Yeah, and one thing that's coming up in assumptions for me is that we're assuming we understand the purchase behavior of our guests now. Are they still going to purchase in the same volume that they did in the past? Can we get the same numbers we did in 2019 now? You know, even with full vaccine, are we back to 2019 or is this new territory? And how do you plan financially for it?
So how do we make plans as we move ahead? How do you project usage, attendance, and so on? This reminds me of something that Brooke said at the very beginning of the pandemic, which is that retreat centers are going to be the last thing to open right before cruise ships. So Heather's bringing it up, it's like, how do we project into the future? It's like, what is the pace of opening going to be?
I think in addition to that, we're making some assumptions about fear levels. I was having a conversation with our board who was saying, well, yeah, once the vaccine's in, we can at least do the limited number. I said, if that many people want to come back, you know, we're assuming that if we're open, people will come, but there is still a fear level out there of I need to be sure that it's safe enough for me.
Okay, maybe one more so we can move on. We're going to move to small groups soon, Ben.
I think there was also an assumption that in 6 months, 7 months, we're going to be past this and we will be building, which we're hoping is going to be true. But there is also the possibility that we could hit another wave. So as we plan, are we looking for that potential in there as well, so that we may well be rebuilding and then all of a sudden have a downturn again?
So we're planning, we're all looking forward to the date in which there will be a vaccine, but January's pointing out there could also be another surge in 6 months.
I'd like to share, which is that the assumption that the work of retreat centers to provide centering and grounding places has never been more important. And my assumption is that is worth some amount of risk.
So that our calling is still real and that there's going to be a risk involved in the solution. So as we're thinking about policies, it's going to be not aiming for no risk, but assessing what is worth it in order for us to fulfill our calling. What we're going to do next is, so these are our questions and our assumptions were captured in the Google document. And Ben is going to divide us into groups of, how many, Ben, in each group?
I've got groups of about 4 or 5. I can change that if we want fewer.
4 or 5 is fine. And I asked him specifically to split us up if we're in the same organization, and then also mix up the geography and the type of retreat center so that each small group has people from different parts of the country dealing with different kind of questions. And the lead question, which we'll put in the Google Doc, is start thinking, now that we've heard we heard what people have been doing, and there's a whole variety from completely shut down and virtual, that's what we've done at Commonweal, to people that are hosting groups, as we heard from Paul, with a lot of small groups and individual retreats in the middle. So we heard what people are doing. We talked about what are our questions, like what are we holding? What is it that we feel like we need to know? And the third thing we talked about is like, what are some of the assumptions that we're carrying with us so we know kind of what is the groundwork? So the next point is when we're in small groups is like, so informed by these, what are some of the strategies you are thinking for opening? And that could include things like policies. What kind of policies do we need? Jane Marie, I think, was talking about in our publicity, what kind of behaviors do we require? Paul was talking about not accepting a group because they weren't willing to wear masks. So in the policy level, in the structural levels, what are those policies that we need? Both reflecting on our own retreat centers, but also looking at the sector as a whole. In each small group, I would suggest that maybe the person whose name is closest to the end of the alphabet will be the person who could become the facilitator, and somebody could volunteer to maybe take notes in the Google document so we can capture that as much as we can. So then maybe our work can coalesce around like, what are the core questions that we're sharing, and we can start developing maybe some of those things that are needed. Does that make sense?
Mhm.
Good. So we'll divide up into groups of 4 or 5. It's 11:15. There's never enough time. So assuming there's 5 people per group, that's about, let's say 3-4 minutes per person, but also allow a lot of time for questions and answers. So we'll give people 25 minutes. We'll give 25 minutes for the group end. And then in the last 20 minutes, we'll go over the Google Doc and see if we can capture. Notice threads, notice assumptions to try to capture. There's things we're laying the foundation for our work for the next few months so we can actually develop some tools that all of us can use. Okay? Excellent. Ben, press that magic button thing that you do.
Take care.
Here we all come back. Ben, can you put the link to the Google Doc back in the chat?
Sure can.
And
It's
I
been
wanted, as we're coming back, is go to the Google Doc and start looking at some of the thoughts that were captured.
Appreciate that one of the groups started selecting which questions were for a doctor. So the doctor question is really helpful. If people could highlight those, we'll be able to pass those on to a physician for our call February 5th.
As people are coming back, I'm inviting you to take a moment to look at the Google Doc just to kind of get a reflections of what the different groups said. Some questions to plant in your mind as you're reading it is, are there questions here that we can find expert resources? As Ben mentioned, we're going to have a conversation with a physician so we can ask her some questions about it. I'm also feeling, at least in the group that we were talking about, we didn't know what the legal parameters are. So we may want to find some attorneys or legal scholars that could help us. So as you're looking at this, what are some of the questions or people resources? Let's just take a few minutes to look at it. Anything pop out, anything, feel free to keep reading, but if anything jumps out of you as you're reading this, please, let's spend the next 10 minutes just kind of reflecting on that. Okay, there's a lot there. This is like instant strategic planning. Anything jumping out at you? Any thoughts, any questions?
I think one thing that I'm noticing, this is Brooke, in reading Natalie's comment about taking care of staff first. I mean, I think we are in a different moment. I mean, often at Watershed, we take care of our staff, but I think oftentimes we sort of sacrifice ourselves if there's a late night emergency, or, we're really trying to support our organizational leaders that are there on retreat, like holding the agenda. And we're kind of running interference if there's a medical emergency, and really like having to commit to not do that, to really be in conversation with the organizational leaders about taking on the medical responsibilities, so that we're not endangering staff or ourselves. And I think we often, I know that at Watershed, and I imagine most of us here orient as caregivers, but really having to set internal boundaries so that we are stopping ourselves from endangering ourselves.
This makes an additional area for maybe to work with the medical provider, but how do we protect our staff? Other things that are jumping out or questions? Great. So maybe the next topic to jump into is then where do we want to go from here? As RCC, one of the things that's coming out is that we're sharing a lot of these questions and these assumptions and some of the strategies. So how can we work together to help address some of it? One of the things, as Ben was mentioning, is that we can bring in experts. We're all networked in different communities in different ways. So bringing in a physician, Brooke, maybe we can bring in that friend of yours that talked to us before about testing. We have another physician that could come in that we can ask all these questions and share this document. The other resource that came up was around legal questions that might be a little trickier because a lot of them are state and county specific, or in our case, we're in national parkland, so it's actually a federal question. But that's another way to at least get someone in that could understand. What other resources might be helpful? They don't have to be experts. What ideas?
One of the things that I heard and saw in the document was the psychic toll that this has on, spiritual caregivers or psychological caregivers for all of us.
So create some kind of circle or space or spiritual support for people that work at retreat centers and run retreat centers. Thank you. Great idea.
Yeah, I can't help but just feel hungry for how this interruption becomes a breakthrough for, the role of retreat centers as transformative centers. The amount of trauma that people are carrying and will be carrying. So support for, rather than each of our centers creating our own, sourcing our own content, what are some shared content experiences for engaging trauma and the kind of healing, collective healing. So I think some potential for shared content development.
Thank you, Heather. Heather, not that Heather, but that Heather. Also talking about financial planning in uncertain times. How do you project and do financial planning into the future? That is an area of expertise. There are people that study that, but that could be something that we can get some support around.
this isn't someone who we bring in, but it perhaps is a way we can be a resource for one another. And we talk about this all the time, but as we develop documents within our centers or develop protocols or put things in place, if we could share them, and I know Ben's been working on a way in which we can do that, but if there are ways that we can post them, make them available so people can see what other centers are doing.
Thank you. So create an archive of the collection of documents. Ben, maybe towards the end, we'll give you, well, actually that's soon. In 4 minutes, maybe I can turn it over to you so you can give us some ideas about what you could do.
Sure, sounds good.
Other thoughts or questions or suggestions as we move ahead?
I just said, this is Brooke. I just had a thought, you know, in that the Fetzer Institute and this whole community has been so committed to racial justice and social justice, looking at class and race and culture, knowing that some of the studies have definitely shown how much, how many of our retreat centers are run by people who identify as white. And I think that there's sort of the anti-vaxxer world, but then there's a whole lot of folks who have been culturally traumatized around medicine. And I think it would be really useful for us to know, to take the responsibility on collectively to really educate ourselves around why that's true. And what is some of the historic traumas that communities have suffered that would lead them to make different choices. So that, because I know that I feel like I have a personal bias that comes up that is quick to think of people as ignorant or misguided. And that is very much related to my own white privilege. So just thinking about that as a community.
Thank you. That's we do have a JEDI initiative. If you want to have more information about that, there's a few people here who can help you, but Brooke is bringing in, how does that intersect with some of, as we're looking at vaccinations, that we're looking at how communities react, where's those intersections and what do we have to consider? And how do we consider our own white, those of you that are white, privileges and perspectives? So Ben, I think I'm going to turn it over to you to kind of, as the coordinator of RCC, what are some of your thoughts and reflections? And then hopefully we can end just with a moment of silence because this has been a lot of information.
I'm very grateful. It was beautiful to watch that Google Doc just explode with everyone's information. So that has not happened in that way before in this setting. So that's really exciting that we trust one another, that we've built that space where we can collaborate. This felt like collaboration today. I'm going to put a folder link in the chat. This has been our folder, our Google folder that we've used all year for our community response to COVID. And it was very busy in the first 2 months. And then I think we all got into our own things. But it's still there and we can still share policies and other resources, sort of like what Jane Marie was mentioning earlier. That's a great spot to just upload a PDF or upload whatever document you're sharing with your guests, and people can bounce ideas back and forth. But I think the document that we were just in together today is another place where you could actually put in a link to something on your website that you've shared with your guests, a statement or a policy or some other information. So that could be more of an ongoing conversation space. I think a folder is kind of a hard place to talk about what you're seeing in the folder, but the document that we were just communicating within could be a good place to go back and forth if you want to be able to see that whole conversation record. To not overwhelm you too much, we also have our Mighty Networks platform, which is a social platform specifically for conversation in a virtual space. And so if you're not already a member of Mighty Networks, that's a great place to continue this conversational thread and tap in more resources as well and say, hey, what are your thoughts about the way I've worded this document, and actually get real-time feedback if people want to participate in there. So Google Drive, if Google Docs are something we're comfortable with, great. I saw a lot of comfort today, which was great. Mighty Networks might be a little stretch further. But I'll put the link to Mighty Networks in the chat as well. This conversation will probably continue either under coronavirus theme or under just the community call for today. And I'll have the video and the blog post and all that comes out of this call. So we'll have a record of that to share. Justine, have I missed something here? I feel like I want to check with you.
I think that's wonderful. I would just quickly say, if Mighty Networks, you don't even know what that means, we are doing a bit of an orientation or drop-in in 1 hour, and been in the same Zoom room, correct?
Correct.
So you're welcome to pop in there. And then I think we will have a community call. I know we'll have a community call next week on justice, equity, diversity, and inclusion. So I see some of those threads already emerging here, and we'll continue carrying that in. Thank you.
Back to you, Oren. Thank you.
I think that I'm very conscious of how RCC has so much emerged ever since COVID started before that. So maybe just ending with a moment of silence and grounding, just to kind of hold the space for a minute for each other, recognizing the challenging year that we've been through and the challenging year that's coming ahead. I'll ring us in and out, and I don't know if you can hear this, but I hope you can. Thank you for being here today, Ben, Justine. Thank you for holding this initiative. Jean and other members of the steering committee and the core committee at RCC, thank you so much. And I promise we will continue this conversation.
Thank you, Oren.
Thank you, everyone.
Thanks,
Bye,
Ben.
everyone. Be well.